Very good morning to the viewers of MASA Facebook page, MASA Faculty of Dentistry Facebook page, and MASA University YouTube channel. Today we have a special topic, and we have also a special speaker. Our topic today will be about the career progression in dentistry. As a dental students while in dental school can practice settings and specialization opportunities. After graduation from the dental school, there are a number of practice settings opportunities that they can explore. It is important to research your options before you graduate dental school, so you are informed about the direction that will pursue. Please let me introduce our speaker for today. Our speaker for today will be Associate Prof. Dr. Santosh Kotian. He is currently the Deputy Dean for Postgraduate and Research at the Faculty of Dentistry in Masa University. Dr. Santosh was the former head of Doctorate in Restorative Dentistry Program at the Faculty of Dentistry in Masa University. He successfully led the program for MQA accreditation. He was an invited speaker and hosted educational forums in national and international conferences and had experience of 17 years in teaching. Dr. Santosh has successfully guided and supervised undergraduate students and postgraduate students in their clinical exercises, research, and table clinic activities. Please welcome Associate Prof. Dr. Santosh for giving today's lecture. Please feel free to add your question in the chat box, and Dr. Santosh will go through and answer your questions. Good morning, sir.
Good morning, Associate Professor Dr. Maan. Thank you so much for your kind introduction. Thank you. So may I start now?
Yes, please.
Yes, thank you. Good morning, everyone watching us today. This is Associate Professor Dr. Santosh Kotian from Faculty of Dentistry, Masa University. I think some of you watching us right now, all of you are quite familiar with me, of course. I hope I don't need a separate introduction. But whoever is watching us from outside Masa, I think we have some students, alumni of PIDC also joining us today. And whoever is outside these two universities, a warm welcome to all of you. I'm Associate Professor Dr. Santosh Kotian. I'm currently the Deputy Dean Postgraduate and Research, Faculty of Dentistry, Masa University. So today I just want to talk briefly on something about career progression in dentistry, a question that most parents ask during our open days and education fairs, and most students also wonder after their 5 years of DDS, how do they go ahead? Not because there are no options, but because there are a lot of options. We sometimes students can be a little perplexed as to which path to choose and which path is good for them. So today in this brief talk of mine, it's my attempt to throw some light on this, right? So let's get along with it. So this is me. Recently, we had a great successful international conference called MIDS, and this is a picture from one of the pictures from that event. Okay, so my introduction is done, so I don't think we need to do that again. This is Masa University. For those who haven't been to our campus, this is how our campus looks. Of course, this is just a small view of a campus. Our campus is pretty huge with multiple faculties of medical, dental, engineering, business, etc. Plus, we have even indoor and outdoor sports facilities for students and the hostel within the campus. Okay, so all of you who are watching us right now, kindly, please scan this QR code right away. It's very important for us to know our audience, and this will also help us to get back to you if you guys, any of you are interested in joining us in Masa. Okay, so please scan this QR code. I'll just brief you also about the Google form that will open when you scan this. So you'll have three options of Masa student, Masa staff, and public. So all our year 5 students or all the Masa alumni who are watching us, you can select as Masa student. And whoever is outside MASA, like the PIDC alumni or anybody from the public, you choose the option public. Yeah. And later on, after you scroll down below, you can choose. There's an option where you can write exactly where you're from. Are you from public? Are you from PIDC, etc. Okay. So please fill up this form. It's very important for us. Thank you very much. Okay. So let's get to the issue. What after DDS, right? So I'm sure most of you are in that the point in your lives when you have to choose as in which path to take, right? What after DDS? I've done my 5 years. I have done a little bit of everything, prosto, conservative, perio, oral surgery, but now which way do I go to? What do I do? So this time when you are actually waiting for your government posting, some of you who have just graduated, some of you probably from the alumni who have already done your government postings, maybe you're still thinking about where to go. So let's see what are our options. Of course, there are a lot of options available, right? You can just go to do your own clinics. You can join other clinics and work there. You can give some competitive exams to go to outside Malaysia, outside countries, right? So many options are there. You can also go for research fields actually. So I will brief about all this one by one later on, right? And of course, we have that option of doing post graduation also. Right. So, well, this animated figure here looks quite confused, but I hope by the end of this presentation, he will be happy. Okay. So, if you want to know more information about our university and our faculty, please go to masa.edu.my, and under faculties, go to the dentistry, and then you will be welcomed by our dean on the page. That's our Professor Dato Dr. Muhammad Ibrahim Abu Hassan. And you can, as you go through the different options, you will be able to see everything about our university and our faculty. All the different program brochures are available and you can go through them. Okay. So there are easy buttons to even connect to us directly. So these buttons are there throughout the website, and you can always click on these buttons and you can contact us directly, or you can, whoever has my number can WhatsApp me also directly. Absolutely no problem. Okay, so these are the undergraduate programs that we have in MASA, that is Diploma in Dental Surgery, Diploma in Dental Technology, and Doctor of Dental Surgery. So what after this? So currently in Malaysia, you have a 1+3 year post-graduation program system. Okay, so this has been started only recently, about 4 years back, and there is no more MClean Dent and DClean Dent. So whichever universities are having MClean Dent and DClean Dent still are the ones that they are just finishing off the batches that had already started before 2018. Okay, so all the universities are gonna go for this new format, which is 1+3. This is 1 years of Master of Orofacial Sciences and then 3 years of doctorate. Okay, so this completion of 1+3 is going to give you a specialist qualification. Okay, so if you're planning to work in other clinics or have your own clinic, very soon it might become mandatory that you need to have a specialist qualification to do certain procedures. Okay, so getting this specialist degree is going to become very important very soon. Okay, so it would be a very good plan now, as soon as possible, if you can join post graduation, so that within a span of another 4 years you will already become registered as a specialist. So like I said, this is one of your options. A lot of options are there. We will go through all of them, but let's start with post graduation first. Okay, so at MASA, we have Master of Orofacial Sciences since 2018 already. We have 5 batches graduated already, and Doctor in Restorative Dentistry we've started in 2019, and our first batch graduated just now in this year. Okay, so already we have 4 students graduated from this Doctor in Restorative Dentistry program. Doctor in Periodontology, we have just started in this year only. Our first batch is just started in Doctor in Periodontics. So right now, our master program we are offering in restorative dentistry, periodontics, and orthodontics, which is a 1-year program. And after that, currently we have doctorate in restorative dentistry and periodontology, and hopefully we will be starting with orthodontics also very soon. Now, apart from all of these, we also are offering here Master of Science and Doctor of Philosophy by Research, which is this is basically Master in Research and PhD in Research. Okay, so these programs are also available here in MASA. So if any of you are research oriented, right, you can go to research field also, right? This research field is also very fruitful. There's a lot of demand in academic areas and research fields. Okay, I know a lot of colleagues who have been in teaching doing their research, but now they have actually gone into very reputed research institutes and are in very high positions in international research institutes. So there's a lot of scope when you do Master of Science or PhD by research. Now, in dentistry, we all know that things are changing, right? Like, for example, when I did my BDS many years back, okay, digital was definitely not there, right? We were still, implants was still a new thing at that point of time. But now slowly things are changing, and not slowly, actually very rapidly, especially after the pandemic era that we had. Things have taken a big leap into the digital world, right? And even dentistry is following suit. There's a lot of digital things happening, a lot of digital softwares coming into dentistry. A lot of new softwares are still in the working stage, but it will not take much time before it becomes very common. So those who have already done your DDS, now it becomes very important to that you need to do something to upgrade your skills. You need to learn these digital things, you know. So even us, for lecturers for that matter, even us who have done DDS for a long time, we are also constantly upgrading our skills by learning all the new things that are coming up. Okay, so it becomes very important to all of us. So you're all like my colleagues right now, actually, since you're all of you have completed your DDS. So it's becomes very important for all of us to know to learn this. Okay, so of course there are a lot of workshops available everywhere within inside our Masa University also, and outside also. You can go and learn from there also. But the advantage of going to a post graduation program is that you will be taught in a more systematic way, right? In academic environment, right? In a more systematic way, and of course at the end of it you get a degree that qualifies you as a specialist who knows all these things rather than just a certificate, right? So that is the advantage of going to a postgraduate program. So the pictures that you're seeing is on the right side is actually our postgraduate students in Masa. So we have already started with digital work for giving prosthesis for patients, that is crowns and bridges as of now, and we are still working towards starting with digital dentures very soon. Okay, so yes, so no longer have to do put our patients through the hassle of having uncomfortable impression materials in the mouth. So we can go digital now, just scan and then we can print the models. Even wax ups, right? I'm sure in your DDS you have done a lot of wax ups using wax, inlay wax. So even that can be skipped now. It can be done digitally and printed as temporary crowns. Even implants and even endodontics for that matter has gone up digitally. Now we can use a lot of softwares to plan the placement of implants, the exact accurate planning placement of implants without disturbing the important anatomical parts over there. Plus, even endodontics has become very easy now. The access and the view to see the root canals, the orifices has become easier by using the endodontic microscope. So all these things you can get more and more experience only when you join a postgraduate course. Because if you go to a workshop, you may be using it for just one day, at the most 1 or 2 days. But when you are doing a postgraduate program, you can use these facilities for the period of 3 years. right? So this is just, I want to show some pictures about all the new things that are coming. Dentures can be printed, crowns can be printed and milled. So it's, everything is going digital now. We don't really have to wait for 4 to 5 appointments or more when you are in DDS. So you don't have to do that anymore. We can give dentures and crowns to patients within 2 appointments, actually, right? It's possible. So it becomes very important that we need to accept and learn these things to upgrade ourselves. So let me just brief you again about the postgraduate program. The 1 year program is the Master of Orofacial Sciences. Like I said, we have in Resto, Perio, and Ortho. So what are the entry requirements? I will come to it. Okay, what is the structure? Structure is, we have 5 modules basically. One is the Applied Medical and Dental Sciences. This is basically for you to refresh your knowledge for what you studied in DDS, especially in year 1, year 2, year 3, which can seem like pretty long back, especially if you guys have graduated a few years back. It might seem like pretty long back, but since you all know, although we are dentists, the related knowledge from the rest of the body is very important, right? So this module basically helps you to refresh the knowledge that you had studied in DDS. Okay. Of course, also important to note here that if you have done your MFDS already, then actually you can skip answering this subject for the exam. You still have to attend classes, because it's always good to remember and revise things, but you don't have to write the exam if you have your MFDS for this subject, which is Applied Medical and Dental Sciences. Apart from that, we have research methodology and a minor research project, and we have also community dental practice, basically where we go for dental camps and all that. So this basically helps you to improve your soft skills with the community. And then the fifth one would be the module that you select. Okay, it could be restorative dentistry, periodontology, or orthodontics. Enter requirements for Malaysians, basically you just need to have done your DDS, that's all, right? You don't need any clinical experience to join the master program, the 1 year master program. So if you've just done your DDS, you can immediately join. In fact, if you're even postponing your government postings for any reason, maybe you did not get your the location that you like or something like that, you can actually do the 1 year master program before that also. It's possible, right? Otherwise, after your government posting, you can go for this master program. Okay, so this 1 year master program basically helps you or gives you more opportunities to do more and more cases, because in your DTS you have very little time to do a lot of cases. You can not able to do a lot of cases, but here in this 1 year program you get this time to do more and more cases, more dentures, more crowns and bridges, more root canal treatments, more perio treatments, right? So you get more options, more opportunities to do this, and you can upgrade your skills with having lecturers helping you, supervising you, and to teach you anything extra that you need to learn beyond the DDS curriculum. Okay, so yes, this is a 1+3 year program, like I mentioned. So that means you can just do this 1 year master also without doing the doctorate, but you will not be registered as a specialist if you don't do the 3 year doctorate. Okay, so if you want an opportunity, if you want to take 1 year to improve your skills, then yes, you can join this master program. What after this master program, you can still join teaching institutions as tutors. You can handle preclinicals, etc. Plus, of course, you just get this opportunity to improve your skills, but definitely you will not be able to become a specialist or get a certificate as a specialist. So it's important that after your DDS, if you're doing master, if you want to become a specialist, you have to do your doctorate. Okay, otherwise you're just getting an 1 year opportunity to enhance your skills and maybe join any educational institution as a tutor. Right. So next, move on to the doctorate program. Okay. So the doctorate programs are available in restorative dentistry and periodontics in MASA. So now, when I'm saying MASA, what programs are having in MASA? Why I'm saying that MASA? Because actually MASA is the only private university having this as of now. Okay, there are a few other public universities which are having this master and doctorate program, but currently MASA is the only private university which is having this 1+3 year master program. master and doctorate program. And that is why I'm telling you MASA all the time. Okay, so if you want to go to any private universities, MASA is the only option currently, right? Otherwise, you can only, of course, you can go for other public universities, right? So doctorate in restorative dentistry and doctorate in periodontics is currently running in MASA. So what do you need to join this program? Of course, you should have done your DDS, and of course, you should have done your masters. Okay, so this masters can be this Master of Orofacial Sciences program that I just spoke about, or any equivalent master program if you're done elsewhere. Okay, inside Malaysia, outside Malaysia, can even if it's outside Malaysia, we can work out on the credit scores and all that, and we can help you. Okay, so DDS and master degree very much important. Also here, a stark difference from your MOFSC requirement, the master requirement. There, no clinical experience was required, but here 2 years of clinical experience is required. Okay, so you can do the doctorate program only after you have a 2 years clinical experience. Now, okay, now some of you might be already be confused. Okay, master does not need clinical, doctorate needs. So how do we handle this? Well, what you can do actually, so okay, so some of you, if you have already graduated a few years back, so definitely you already have your 2 years of clinical experience, right? So that means that you can already join this program, right? You can directly go for the 1+3 program, absolutely no problem. But if some of you have recently graduated and you haven't completed your 2 years clinical experience, you can still join the master program, definitely, because that does not need any clinical experience. But after completing that 1 year master, you can just work a few more months or whatever the remaining period of months is required for you to complete your 2 years, and then again join the doctorate program. Okay, so to facilitate this, here in MASA, we'll actually offer you a teaching position, a clinical position over here in the faculty, so that you don't have to go elsewhere looking for this clinical experience. Okay, so you can get a clinical attachment in MASA itself after your 1 year master program. Okay, so we have already students like this who are with us currently doing the doctorate program, who completed their 1 year master here, and then they had a few months remaining to complete their 2 years. So they worked here as taking a clinical attachment in MASA, and they completed their 2 years and then joined the doctorate program back. So you can do that. Okay, so this is mainly, of course, this is a minimum requirements for all Malaysians. But if it is anybody who is a non-Malaysian, the same requirements, of course, plus you will require a proper certificate from your country, a practicing certificate to show that you are a qualified dentist. Okay, and plus English proficiency would be very important. So after doing your 1+3 year program, a lot of opportunities will open for you. A lot of doors will open for you. Of course, you can go to private dental clinics and do your own private practice, whether it's your own clinic or somebody else's clinic, that's fine. But also you can go into Ministry of Health if you're interested. Okay, you can go into Ministry of Defense as dentist over there, and also into educational institutions where you can actually start as a senior lecturer and then progress higher up as associate professor, and maybe become deputy dean one day. Okay, so there's a lot of opportunities opening up from here, right? Okay, so just let me show you what facilities we have here. Of course we have our CBCT over here. We have 3D printers. We have our intraoral scanner, endo microscope, and a huge simulation lab. We have about 150 chairs of individual chairs in the simulation lab. This is where the students practice, they do their preclinical training. So even for your master program, we actually conduct simulation. So the simulation is not only in DDS. So we understand that a lot of students will be coming to the master program after having a break from DDS, right? So maybe in the clinic that you're working currently, you're doing only a certain type of treatment procedures, maybe not all, but when you come here, maybe you need to kind of refine your skills. So we actually conduct a simulation exercise in the master program when the students join. So we want to bring all the students to the same level, because many students come from different universities, different backgrounds. So we want to bring everyone to the same level. So we conduct simulations even in the master program. And then only you can go into the clinic, so that you are confident when you start the patients. For clinics, if anybody from Masa, you already know that in clinics we have about 4 to 5 floors of clinics, dental clinics here. For DDS, for each year, year 3, year 4, year 5 is a separate clinics. Plus for postgraduate also, there's a separate clinics for at a different level altogether. Right. So some of the pictures I want to share here, how we have been doing our teaching for postgraduate students. So like you say, we start from the basics also. So you don't have to be worried or shy if you have taken a break from DDS, or if you have not done certain procedures. Okay, we will start from scratch, and we will help you refine your skills and remember all the things that you have learned in DDS in the master program. So that 1 year master program is basically like a bridge. It links your DDS knowledge to what you're going to learn in your doctorate program. Okay, so these are some of our postgraduate students using the intraoral scanner and the endo microscope. We have dedicated facilities for the postgraduate students, as in there's a separate postgraduate room for students to relax. We have like a lounge, small lounge also. It's even better now. This is actually a bit old picture. We have a separate classroom also for the master students. Okay, so there are dedicated facilities for postgraduates, so you don't have to overlap anything with DDS. Absolutely no overlap of facilities with DDS. Okay. Plus, these are some of the universities that we have a memorandum with for student mobility. University of Kutisastra, Manubhai Patel, Erlanga, Savita, and Tagore Dental College. Also, we have Vinayaka Mission. And for postgraduate, hopefully very soon we'll be doing an MOU with Maidol University in Thailand. Okay, so very interesting things coming up in our postgraduate program. Right. So that was one option that you have, that to go for postgrad. But what if maybe you're not sure whether you want to still go to postgrad or not? Okay, maybe you want to think for a while. Maybe in the meanwhile you want to do some workshops and everything. So like I said, there are a lot of workshops nowadays everywhere. Outside, you can see on Facebook and Instagram every day there's a new workshop popping up. Plus, at the same time, even in Masa, we are conducting a lot of workshops. So I just want to show you all what workshops we are doing here. We have a training course in dental panoramic imaging and CBCT, which is very important for all practitioners right now. So actually, if you attend this training course here in Masa, you can get the certificate for handling the CBCT and dental panoramic. So already we have had a lot of batches coming here, attending this course and getting the certificate. So all these workshops, if you want to know more information, you can contact me later. So in this workshop, we are showing you, we'll be teaching you and training you everything about radiology, that is panoramic and CBCT. And also we have our lecturers telling you about the application of CBCT in implants, planning of implants and endodontics. Also, we are doing the advanced prostronautic workshop, the crown and bridge workshop, where we train the students for crowns, bridges, onlays, etc. We've had many batches. We are doing this workshop since 6 years now. Maybe only during the pandemic we did not do. Also, there is impacted wisdom tooth, minor oral surgery, also workshops we have been doing every year. And we have had a lot of our alumni also coming back to attend this workshop. Periodontics workshop also we have started since the last 2 years now. So as you can see, animal jaws are given to the participants to practice their periodontic skills. Okay. And of course, oral implantology training program we have here in Masa, also running since many years now. And we have a lot of specialists and in implants also training the students here at Masa. So these are just some of the pictures that I want to share. These are actually our postgraduate students, and these are some of our alumni and also students from outside who are coming here to attend this program. Also, we have molar endodontics simplified workshop, okay, where endodontics is where students are trained in getting some higher skills in endodontics, and also you can upgrade your skills and try to learn newer techniques from our endodontic lecturers over here. This is AP Dr. Kranti. I'm sure all of you know him. So we have all workshops conducted over here. So if you're not aware, or if you're aware also, and you've never come here, I think you can always come and join one of these workshops. All these workshops are conducted every year, at least once, sometimes even twice in a year. Okay, so you can contact us if you want to attend any of these workshops. This is just the picture of MIDS that I mentioned just now, because MASA conducts this conference every year in May, and we had a very successful conference just now with about 1,000 delegates registered. So it was very successful, and every year we are going to do this. We are going to do this in next year, also in 2024. So this is just a welcome message to all of you for the next conference. Plus, we are going to have a conference in Masa University also in December. It would be December 7th and 8th, and soon flyers will be sent to you. We have some extremely interesting lineup of speakers coming up. So in December this year, December 2023, 7th and 8th, we are going to have a conference, Masa Maiden conference also. I'd like to share some testimonials from our first batch of doctorate students. This is from Dr. Korchu Pang, quite popular in the dentistry scenario there. He's having about 4 to 5 clinics, I think, in and around Kota Kemuning area. And he's from the first batch of our doctorate program. This is Dr. Priya, the top student during our doctorate program. And this is the testimonials from her. Of course, if you come to our open days, which are conducted every weekend, okay, every Saturday, Sunday, we conduct open days in Masa University campus. So if you come here, you can see more of these things. We have a lot of brochures and videos constantly playing on the television there here. So you can go through all these information that I have shared and go through all the testimonials of DDS students as well as postgraduate students. Finally, I want to talk about one more option that you guys can go for. I told you about postgrad, I told you about attending the workshops, right? There's one more option if any of you are interested in the research field, right? I mean, I'm sure there will be some of you who have done research projects during your DDS program or even during your government postings. You guys must be doing some research. So if you have an inclination towards research field, I would suggest you go get a degree in it, right? So once you get a degree in it, a lot of opportunities will open up for you. Like I said, I have a lot of colleagues who have been in the teaching field and doing some research, and slowly they picked up. And now there are a lot of international institutes who have hired them, okay, and they have become a member of these international research organizations, and they're doing very high-end research now, okay. So this option is also there. There is nothing to feel shy about it. Some of you may think like, oh, I'm supposed to be a dentist. How can I go for research? Absolutely, you don't have to think like that. Okay, there are a lot of options to that, and I think it's always better you do something that you're interested in rather than you struggling in something that you're not interested in, right? So if you're in research can be, of course, clinical and non-clinical, right? Even those who are in clinical practice also can do research, right? You can try different techniques, different materials on your patients, of course, with all ethical clearance and all that. And you can come up with something new, right? You can come up with something new and contribute to the field of dentistry. Remember, whatever we are using today, even from the simplest alginate impression material, which has been using since decades now, to the intraoral scanner and 3D printers which we are using today, everything is an outcome of research. Remember that, okay? So just like that, these things have not come into the field. There has been somebody who has done research in these things. Okay, if whenever alginate was introduced to the market, probably in the 70s and 80s, 1970s and 80s, there must have been so much of research done to see whether this material is good enough or not, right? Exactly same way, even now, the milling and printing and all the softwares that we are using, there has been research done on this to see whether these are efficient or not. Okay, and whatever we are using now, all these things are the outcome of this research only. So on, of course, most of them will be dentists who have done this research, right? So unless dentists are contributing to research field, our dental field will not progress, right? So this Master of Science and PhD in Research we are offering here in MASA also. Okay, and basically, if you are already a dentist, already graduated DDS, you don't really need any specific qualification if you're going for master. Okay, but if you're done your, if you're going for PhD, you will have to need to done your masters first. Okay, so if you're going for the Master of Science, that's just shown here, if you're done your DDS already, then you can directly join. Okay, but if you're done your, if you're going for PhD, then a master's degree is required. Okay, so of course your research field can or may not be restricted to dentistry also, right? A lot of things like in dentistry that we use is interrelated with other fields like microbiology, pharmacology, tissue engineering, right? So dental means, you know, dentistry is related to all the other medical fields also. We are not like single separated entity or something, right? So your research can extend to other branches also and indirectly contribute to dentistry. Okay, so that's it for now. I have discussed quite a few options with you all, and of course there can be many other things that we can talk about, but I think within the time that I have today and without making it too boring to all of you, I think I should stop here. But we are open for discussion, and those who have joined late, those who have not scanned in the beginning, please scan this QR code right now. Okay, because we need to know the audience and we need to know what's your interest and what's your feedback. Okay, so please scan this QR code if you have not scanned it already, right? Okay, and that ends my presentation, but I'm still here. If you want to ask any questions related to this program, please feel free to ask.
Thank you so much, Associate Prof. Dr. Santosh Kotian, for sharing this information.
Thank
I
you,
hope
Dr.
our audience get to know about the postgraduate studies available at Faculty of Dentistry at Massa University. I didn't get any questions so far, but the speech will be available to view in Massa University social media platforms. I hope anyone have a question can leave a comment. Then I can pass the question to Dr. Santosh to answer later on.
Okay, thank you, Dr. Man. So anybody having any questions, you can directly contact us. If you're shy to ask us any questions over here, you can directly contact us and we can give you more information, or you can just come to our open days. Okay, thank you very much. Thank you, Dr. Man.
Thank you so much, Dr. Santosh. Thank you so much, dear audience, for listening to this lecture, special lecture by Associate Professor Dr. Santosh. I will update you later on the coming webinars that will be organized by the Faculty of Dentistry in Massa University. Please stay tuned. Thank you so much and have a nice day.
Thank you.
Thank you.